Yo mientras yo no me atendía con ningún médico, ni de mi presión, y así pasaba yo el tiempo, y aunque me enfermara de gripa o de lo que me enfermara, y yo pasaba así, sin ir con doctor, hasta que se me quitara. Así, pero no, si no la hubiera conocido, yo nunca me atendía yo con médico hasta ahora con ella.
5 years ago, 5.5 years ago, we were living in Southern California. Sarah and I both had well-paying professional jobs, and we just felt a stirring in our hearts that the Lord had something more for us, something different. We planned on coming down for 6 months initially, and we're still here 5 years later. We discovered when we moved here that there's not a great amount of medical care available locally. For example, we're 45 minutes in either direction from the nearest hospital, and so there's an acute need for just basic medical care that Siloe Ministries is able to provide.
Preventative care is not something that is really part of the Mexican culture. Unfortunately, most of that is due to a state of poverty that our patients live in. I have patients in their 50s and 60s who have never seen a dentist. And their mentality is you go to a dentist when you need a tooth pulled.
We want to treat the whole person and to not just treat surface level things, medical conditions or health needs, but also to teach people about healthy eating and healthy lifestyles and really promote that in the local families.
Most of our patients come from our local community. We live in a small area called Santa Anita, which is in the Mission Valley. We see patients as young as newborns, we provide prenatal care, and we see patients up through the geriatric ages. Very poor families that live in our area. The average salary for a skilled worker is about $20 a day.
It's a completely free clinic, and I think that's a huge necessity. Even 20 or 30 pesos is a lot of money locally.
We don't turn anyone away. We don't charge anything for our consults. We don't charge anything for medication. Sometimes our patients will contribute if they can to part of their labs or part of their radiology appointments. But most of the time patients come by and they bring us a plate of warm tortillas or a pot of beans. Knowing that if our child has a cold or if someone cuts their finger or breaks a bone, they're going to be able to have that access to medical care is something that I think we as Americans really take for granted. And it's something that a community like Santa Anita has never experienced.
We really have a vision for transforming our little community. I mean, it's a humble place, but we would love and we believe that we could look back 10 years from now and see lives that have been transformed because of it.